Getting a cast can be both an interesting and nerve-wracking experience, but it's really a simple process. Once on, if you take care of your cast correctly, it will help you heal relatively quickly and get back to your old self. Here's how casts are put on and how to make sure you take care of your cast the right way. First, several layers of soft cotton are wrapped around the injured area. If it's a special kind of cast that can get wet, it will have a special waterproof lining. Then fiberglass will be wrapped around that soft first layer. That will dry into the hard outer shell of the cast. Now there are some things you'll need to remember to care for your cast correctly. The number one thing to remember, keep your cast dry. A wet cast can become soft and won't hold your limb in place. A wet cast can also cause infections or rashes. To make sure your cast stays dry, keep your cast out of water and covered in plastic when you bathe. If part of your cast gets slightly damp, you can dry it with the cool setting on a blow dryer. If your cast gets wet, make sure to call your healthcare provider. Some casts are waterproof. With that type of cast, you can wash, shower, or swim as usual. Let the cast drain when done. You can use a cool hairdryer to help with the process. Sometimes a cast can feel uncomfortable. Here are a few ways to keep it feeling better. Keep the cast raised above heart level to relieve pain and reduce swelling. Wiggle your toes or fingers as much as possible to improve circulation. If you itch, do not scratch inside the cast. Instead, raise the cast and/or change positions. You can also try using a blow dryer set on cool. If your toes or fingers get cold, raise them and cover them with a sock or blanket. You should call your doctor if you're experiencing persistent pain, swelling doesn't respond to elevation, you experience a change in sensation, if your ability to move your fingers or toes decreases, or you notice changes in color or temperature, if you notice odors, stained areas, or warm spots, or your cast is too loose or too tight. Lastly, here are some do's and don'ts. Do keep the cast clean and dry. Cover it with plastic to protect it from dirt or water. Do use any support you are given, like crutches or a sling. Do elevate the cast above heart level whenever possible. Don't bang your cast. Don't slide anything inside it. Doing so could cut your skin and lead to an infection. Don't put lotion or powders around the cast or inside it. Don't wash the cast, and don't cut the cast or pull it apart. Removing your cast is simple. A special saw will be used. It has a dull blade that vibrates through the hard shell of the cast. The vibration won't hurt your skin, but it might tickle. Then the cast is pried open to reveal your newly healed limb.